Scans of the heart. Before that, we have to just revise this model. What are the structures and what we are going to see in this. So here you are able to see the right ventricle, the left ventricle. This is pulmonary trunk and its division. This is ascending aorta, arch of aorta. Branches from arch of aorta, right brachiocephalic trunk. This is the left common carotid. This is the left subclavian. Now on the side of the ascending aorta, here you will see the superior vena cava, and formation of superior vena cava is by the union of right and left innominate veins or the brachiocephalic veins. So you're seeing the superior vena cava draining into the right atrium. Inferiorly, the right atrium has inferior vena cava opening into it. So if you have a look from the undersurface here, from the diaphragmatic surface, you will see right ventricle, left ventricle, the interventricular septum will be there. You will be able to see the inferior vena cava. You will be able to see the two atria. This is my finger is in the left atrium, and inferior vena cava is entering into the right atrium. So with this concept in mind, now let's move towards the CT scan and see how we can identify the structures. Now we will start from diaphragm upwards. So in this section here, you're seeing this gray area, which is the diaphragm, and you can identify the vertebrae. As you know the rule of CT scan, the denser or harder the substance, the whiter it will appear. So bones will be appearing white, air-filled tissues as black, other tissues or organs will appear light gray to dark gray in color. Now let's try to identify structures in this section here. You have identified the vertebrae. In front of the vertebrae here, this rounded structure, this is your descending thoracic aorta. So this is the level at which the descending thoracic aorta will pierce the diaphragm. This is at T12 level. Now this gray impression here, this marking, full marking, is of the diaphragm, but you can appreciate here, this is the spleen, and in front of it, this small area here, this is a part of the stomach. So when you're looking at the CT scan, you are looking at a person from foot and inside. So this is the right side of the person and this is the left side. So on left side, you will see the spleen, you will see the markings here for the stomach, and then this full impression is for the liver. The diaphragm is in this area, and you are seeing these impressions also. Now as we are moving up, you are identifying here the spleen again, then stomach, then portion of liver. And if you see on the sides now, sides of the diaphragm, you will see this black marking is the appearance of the lung. Now the lung tissue has started to appear. Now we are moving inside the thoracic cavity slowly. So let's identify the structures again. This is the liver marking, this is the lung marking, this is your descending thoracic aorta, and this is still the liver that we are seeing. Now as we move up, as you are seeing in this slide, the heart has started to appear. Now as we move more inside in this section, we are also seeing some small structures here with the descending thoracic aorta. These are the thoracic duct and the azygous veins. Now the heart has started to appear. So the first thing that you will see on the diaphragmatic surface of the heart, as in here, so you will have to identify the right ventricle and left ventricle. So here, this is your right ventricle, this is the left ventricle, and this partition here is the interventricular septum. Now the liver and diaphragm markings are slowly fading and we are ascending up. Still you are seeing right ventricle, left ventricle, descending thoracic aorta, and a new impression which was hiding under the liver. A new impression has started to appear. This is for our inferior vena cava. So inferior vena cava is in the picture here. So this slide will have the two ventricles interventricular septum, descending thoracic aorta, and here is the inferior vena cava. Now let's move on to this picture. Same structures again: inferior vena cava, right ventricle, left ventricle, descending thoracic aorta. As we move up now, and the inferior vena cava has to enter into the right atrium, slowly its margin is fading. So as we move up, and you see the lung tissue has started to appear, we can see the hilar markings. We are seeing lymph nodes and other structures in between. So this black zone here and here, this is from the right and left lung, and the heart is enclosed inside. So as we move up, now pulmonary vessels are appearing, and we are moving more up towards, so we are seeing the right atrium here. Okay, so here also you can see the right atrium now. You're seeing the
left atrium
and the pulmonary vessels
picture.
arising from it. Still, okay, this is the descending thoracic aorta. In this picture, the left atrium. As we move up, in this picture, in front of the
then left atrium
now,
again here with the
seeing other structures have started to
branches.
Now we will move on to next. We will take over from here on the next section. Now, as we are moving up now, you're seeing that some air-filled structures have started to appear. So we are seeing the right and the left bronchi now. This is the descending thoracic aorta. Here, this is the ascending aorta. This is the pulmonary trunk, and this is the level of superior vena cava. Clearly shown here in this one, you will be able to identify in this picture ascending aorta, descending aorta, pulmonary trunk, and you're seeing the superior vena cava. Now slowly as we move up, we are reaching a level here. So still you can identify the trachea. In front of the trachea, you have to identify the pulmonary trunk. You have the ascending aorta, descending aorta, superior vena cava. Now as we move up, so we are roughly at T5 level now. As we move on to the T4 level, you're seeing that this ascending and descending aorta, they are forming an arch here. So this is roughly, we are reaching T4 level. So at T4 level, we have to see that the ascending aorta ends, arch of aorta begins, and descending aorta starts. So in this level here, you're seeing superior vena cava, and you're seeing the arch of the aorta. This is the trachea. Now move further up. If you look at this picture here, this is arch of aorta, this is trachea, and this is superior vena cava and some elongation here. So we are reaching to a level where we are seeing that the superior vena cava is being formed. Now if you clearly look at this picture, something from the left vessel is merging towards the right. So you're here seeing the union of the left brachiocephalic vein with the right brachiocephalic vein. See, the mergers here is seen clearly, and then in this picture you're seeing superior vena cava formation. Now as we ascend up at T4 level, from arch of aorta now you will not see arch of aorta, you are seeing three markings of vessels. So from right to left side, these are the right brachiocephalic artery, this is the left common carotid artery, this is the left subclavian artery. Now in front here, you're seeing that the left brachiocephalic or innominate vein is moving towards the right brachiocephalic vein. Here, the left brachiocephalic vein moving because it has an oblique and longer path, and it has to merge with the right brachiocephalic vein to form superior vena cava. Now in this slide here, what are you able to see? Let's talk about the bones now. You're seeing the scapular margins, you're seeing the vertebrae, the ribs, sternum. Ribs are seen on the sides also. This is soft tissue, muscles of the chest wall. Now these are the lungs, these black markings here. This is trachea. Now look here, these structures you have to identify. These three rounded structures from right to left side, right brachiocephalic artery, left common carotid, left subclavian. This is left innominate vein or brachiocephalic vein going towards the right brachiocephalic vein. As we ascend more up, we are seeing the same arrangement of these vessels, same arrangement of the vessels, till we reach to this zone, which is showing the two clavicles, division of these arteries, and here in this picture here you're seeing that the lung apex is present.
Now I have included some labeled CT scans here. You can take their screenshots and you can keep them as your reference for comparison. And we will be sending you some worksheets to label also. So these are the label slides now for you. Hope you have understood nicely.